So National Taxpayers Association is an organization that was established that in acknowledgement of the fact that our government seeks to increase taxes of everyone. But when you look at provision of essential public services, that has continued to decline, or our government has gone to what we call public-private partnerships. If you looked at the road that we have, the express, you pay to use it, isn't it? They are saying they're reducing how much they'll be paying for higher education. And if you look at how much they are giving per child in terms of pre-primary education and compare that with the allowances for foreign travel and domestic travel, you see we have a problem. So our institution seeks to work, particularly at the county level, with what we do is to develop scorecards with communities, look at the Auditor General reports. I don't know how many have looked at the Auditor General report for their counties, and then use that to hold your local leaders to account. So that is the accountability side. However, for purposes of today, we are here as friends of KENCO, because with the support from Bill and Melinda Gates Foundation, together with Tax Justice Network, we have been working on a project that seeks to advocate for increased taxes on tobacco. So as a country, we know we do not want more taxes, but we feel that that blanket conversation around taxation makes us lose on very significant areas such as tobacco and new generation products. If you look at how our country taxes tobacco, we already have a law, the Tobacco Control Act of 2007 and the regulations, and we have also signed at the international level to the WHO, FCTC, that says that the price of tobacco products should be 70% of it should be taxes. But our government has not done that, in spite of the fact that they've said that cancer is a problem in the country. So we have seen our government every time we make submissions to Parliament, and I want to inform us as players here that for the first time last year we did not have any tax on tobacco or new generation products. That is in spite of the fact that we have seen different marketing strategies, and now they are targeting the youth with the emerging products, the nicotine pouches and the e-cigarettes, which have been said from research are more addictive. But our government, from last year when we made submissions to Parliament, they asked us, we need to improve employment and we need to invite investors. My question sitting here and hearing the survivor stories, I do not think we can put industry ahead of people. And so for me, that I find very problematic. And the government needs to decide which industry do we want to promote. An industry can evolve. You can close one industry and people will find another industry. But we cannot find another Kenyan when they are hurt and when they are suffering from diseases. So one is to mention that the politics of the day and the industry seem to be one. And we feel that as civil society players, the reason I've come here today is I have looked, and it is good kuangalia ndani, sindio? I have looked at our advocacy over the years, and the success rate, it has not been as effective in terms of taxing tobacco. But sitting here, I feel if Uncle Zach and the survivors make submission before Parliament, that will be more compelling than civil society organizations. So I'm hoping that this afternoon, as my colleague Ketka and the rest of us members of Ketka have an appointment with the Parliament, because they are reviewing the current tax rates for tobacco in the afternoon at 3, we will have some of the survivors join us and make us see that this is not... So we can move and tell government, easy see stories are jaba. There are people that are living these experiences. And to the government counterparts that are here, I was very excited to see that we have National Cancer Institute, Ministry of Health. And before we came, we looked at the strategic documents for NCI and MOH. And we were very excited to find that they have those 2 clauses saying that they want to tax. So they acknowledge tobacco is a key factor on NCDs. They want to tax it to 70%. So my take here is the strategy runs to 2027. We are midway. And we are here to say we want to support you to realize it, because we also understand that government to government interagency conversation is more compelling also than us as CSOs. So I look forward to some of those submissions not being made by civil society organizations, but government as NCI, MOH, going before the Molo Member of Parliament and asking him why are you not taxing this product that is killing Kenyans?
Yes.
And as I bring it to a close, noting that we have Excellency seated here, we have been trying to speak with the Council of Governors because we know that health is an evolved function. We do not understand why the counties perennially say they are underfunded, but they let government forgo revenue from tobacco industry. So it would also be good to see His Excellency Njuki as the chair of the Health Committee making those submissions and not civil society organizations. So my plea also to you, Excellency, is if you could help us on that front. How do we ensure that we ensure this efficiency of health funds? Because if you allocate 10 shillings to the health sector and tobacco erodes 7 of it in terms of treatment, we are moving backwards. So we are seeking allocations for health, increased healthcare, but we are not looking at the things that erode efficiency of what is already there, and tobacco is one of them. Lastly, as we are all aware, government has been changing how they will finance health, and we have the chronic fund that is already under discussion. Our question again is, how many people are affected by cancer? Will that fund be enough to take care of those needs? We know treatment can move you from where you think you're middle class to poverty. And the people who don't have, what happens to them? But if we are saying that fund, if you hear our president, he said when he was telling us that we need to pay all of us that increased rate, he was leveraging on cancer as the reason why he wants that social funding. But the question then is, if we are sincere as a government and our president is sincere that we'll be putting a social health fund and the chronic fund, the first thing would be then to move tobacco taxation to the highest, to look at any other product that contributes to NCDs and cancer and tax it accordingly. So I'd want to leave it there, but to say that today I have really been encouraged by seeing the survivors, hearing the stories, and we are together in this work. Our way of addressing the cancer issue might be different. For us is the taxation and looking at oversight around health budgets. But the people who are really in the trenches doing this work, we would want to say thank you, and we will continue to support any player in this sector. Asanteni sana, and may we continue to have a fruitful deliberation.